Hello everyone, my name is Michelle Harrington and today I'm going to talk about the importance of hand washing. As a government employee, we follow the guidelines of the CDC, which is an acronym for the Centers for Disease Control. The CDC is a federal agency that conducts studies proven by science to provide health information to our nation to protect us from health threats. We are very fortunate to have clean water and facilities at our disposal, along with education and knowledge of how germs are spread. Yet many healthcare workers, along with the general public, still do not take the time or full advantage in the simple step to wash their hands. For instance, as you are watching this video, what are you touching? When did you wash your hands last? What have you touched throughout the day and then touched your face, eyes, nose, or mouth? Everything you came in contact with is now contaminated, along with everything the person before you and after you. Did they wash their hands? You are now a carrier of germs. We all take for granted that we are clean and take precautions. However, what about the next person? Makes you think, doesn't it? There are several diseases that are spread due to lack of hand washing, such as hepatitis A, food poisoning, salmonella, E. coli, norovirus, chickenpox, conjunctivitis, C. diff. This is just a few examples. Don't assume that even our own physicians or healthcare providers are washing every time between seeing patients. This is why we have many hospital-acquired infections. In 1847, Ignaz Semmelweis was working as a physician and seeing the huge mortality rate within one of the two maternity wards. He began to study the differences between the physician and med student ward versus the midwife ward. He witnessed the physicians performing autopsies and then going into delivery rooms, thus causing infection to the mothers due to the contamination from the cadavers. Semmelweis then implemented hand washing with chlorine after his discovery. There was a dramatic drop in the death rate within the maternity ward. Just 15 seconds of hand washing and friction can reduce the spread of many life-threatening germs. And the overuse of antibiotics, which have created superbugs. And for those of you that don't know what that is, it's caused by overuse of antibiotics that creates a resistance that helps cure infections. Hope this video helps you remember the importance of hand washing and that something so simple can fight the spread of germs. Thank you for your time.